You think doctors are infallible. You think that white coat, that medical degree, that confident diagnosis means they know exactly what's wrong with you. But what if I told you that doctors are wrong 40% of the time? What if the healthcare system you trust with your life is built on guesswork, outdated information, and financial incentives that have nothing to do with your health? In the next 10 minutes, I'll prove that blind trust in doctors is one of the most dangerous decisions you can make. Think about the last time you went to a doctor. You sat in that sterile room. They spent maybe 7 minutes with you, asked a few questions, typed on their computer, and handed you a prescription. You took it without question, right? Because they're the expert. But here's the twist. A study from Johns Hopkins found that diagnostic errors affect 12 million Americans every year. That's 1 in 20 patients getting the wrong diagnosis. And here's what they don't tell you. Those errors kill more people annually than car accidents. The third leading cause of death in America isn't cancer or heart disease alone. It's medical errors. The system you trust is killing 250,000 people per year, and somehow nobody's talking about it. Let me show you how broken this really is. In 2015, researchers analyzed decades of medical research and found that 46% of what doctors learned in medical school is either outdated or completely wrong within 5 years of graduation. But here's the problem. Most doctors don't keep up. A study in the Journal of the American Medical Association found that the average doctor reads fewer than 5 medical journals per year. 5. There are over 75 peer-reviewed journals publishing new research every single month. Your doctor is practicing medicine based on information from 10, 15, maybe 20 years ago, while new discoveries are published daily. But here's where it gets darker. The average primary care appointment in America lasts 7 minutes. 7 minutes to understand your symptoms, review your history, make a diagnosis, and prescribe treatment. Mayo Clinic researchers found that doctors interrupt patients after just 11 seconds of them speaking. 11 seconds. You haven't even finished describing your symptoms, and they've already decided what's wrong with you. They're not listening. They're pattern matching based on incomplete information and hoping they're right. And here's the most disturbing part. A British medical journal study followed patients with serious symptoms and found that the average patient sees 5 different doctors before getting the correct diagnosis. 5 doctors, each one confident they knew what was wrong, each one incorrect. Tum japses. Lag tahai. You're getting expert care, but you're actually getting educated guesses from people too proud or too rushed to admit they don't know. And that's just the surface. Now let me tell you about the real machinery behind modern medicine. Pharmaceutical companies spend $30 billion per year marketing to doctors. Not to you, to doctors. They send sales reps, called drug representatives, to clinics with free samples, fancy dinners, paid speaking gigs, all expenses, paid conferences. It's legalized bribery. A study from Harvard and Stanford found that doctors who receive even 1 free meal from a drug company are significantly more likely to prescribe that company's medication, even when cheaper or more effective alternatives exist. Your doctor isn't prescribing what's best for you. They're prescribing what they've been incentivized to prescribe. But here's the thing, most doctors don't even realize they're being manipulated. Dr. Quaint, Ben Goldacre, who wrote Bad Pharma, exposed how pharmaceutical companies conduct dozens of studies on a new drug, but only publish the ones showing positive results. The studies showing the drug doesn't work or has dangerous side effects. Buried, never published. So when your doctor researches a medication, they're only seeing half the data. They think they're making evidence-based decisions, but the evidence has been carefully curated to sell products. It's not medicine, it's marketing disguised as science. Marcia Angel, former editor-in-chief of the New England Journal of Medicine, one of the most respected medical journals in the world, publicly stated, "It is simply no longer possible to believe much of the clinical research that is published." I take no pleasure in this conclusion, which I reached slowly and reluctantly. That's not a conspiracy theorist. That's the person who used to decide what gets published in medical journals, telling you the system is corrupted beyond repair. And here's where it gets truly sinister. Insurance companies dictate what treatments doctors can prescribe. You need an MRI. Your doctor thinks you need surgery. Too bad. Insurance has to approve it first, and their decision isn't based on your health. It's based on cost. A study from the American Medical Association found that doctors spend 62% of their workday on paperwork and insurance bureaucracy, not patient care. They're not thinking about healing you. They're thinking about which codes to enter so insurance won't deny the claim. The entire system is designed around billing, not healing. Or sabse body baat. Hospitals are businesses. In the USS, 76% of hospitals are for-profit or non-profit institutions that still operate like businesses. They have revenue targets, profit margins, shareholders. Research published in Health Affairs found that hospitals mark up medication costs by 200 to 800%. That IV saline bag costs $1 to manufacture. The hospital charges you $500. That's not healthcare. That's exploitation. And your doctor works for that system, whether they want to or not. So why does this matter to you right now? Because the next time you feel sick, you're going to trust a system that prioritizes profit over your health, prescribes based on outdated information and pharmaceutical kickbacks, and statistically gets your diagnosis wrong almost half the time. That chronic pain you've been ignoring could be something serious that requires a specialist. But your doctor spent 7 minutes with you and prescribed painkillers instead of investigating. That medication you've been taking for years might have severe long-term side effects that newer studies revealed, but your doctor hasn't read those studies. Your mental health is suffering because you're told your physical symptoms are just anxiety when there's an underlying condition being missed. Thyroid disorders, autoimmune diseases, nutritional deficiencies, they all get misdiagnosed as psychological problems because running actual tests costs money and takes time. Studies show women and minorities are even more likely to be dismissed or misdiagnosed because of unconscious bias in the medical system. You're not getting care based on your symptoms. You're getting care based on stereotypes and assumptions. On a societal level, we've created a population that blindly follows medical advice without question, and that obedience is killing us. Medical debt is the #1 cause of bankruptcy in America. People avoid seeing doctors because they can't afford it, then die from treatable conditions. Meanwhile, life expectancy in the U.S. has declined for 3 years in a row, even though healthcare spending is the highest in the world. More money, worse outcomes. That's not a healthcare system, that's a scam. And the doctors who see the problems, they burn out. Physician suicide rates are the highest of any profession. 400 doctors kill themselves every year in the U.S. alone because they're trapped in a system that prevents them from actually helping people. The good doctors leave. The ones who stay learn to work within a broken system, and patients suffer. Here's how you take control back starting today. First, become your own medical researcher. Before accepting any diagnosis or prescription, ask 3 questions. What else could this be? What are the alternatives to this treatment? What are the long-term side effects? Then, go home and research. Use Google Scholar, not WebMD. Look for peer-reviewed studies published in the last 5 years. It takes 30 minutes, but 30 minutes of research could save you from years of unnecessary medication or a misdiagnosis that gets worse. Knowledge is the only leverage you have against a system designed to process you quickly and bill you heavily. Second, always get a second opinion and make sure it's from a different hospital system. Doctors in the same network consult each other and often reinforce each other's mistakes. Studies show that second opinions result in a different diagnosis 30% of the time. 30%. That means nearly 1 in 3 people are being treated for the wrong condition. Tumhare paz surf ikebadi hai. Don't gamble it on one person's 7-minute assessment. It feels awkward to question your doctor, but awkwardness doesn't kill you. Wrong treatment does. Third, track your own health data obsessively. Keep a symptom journal. Note what you eat, how you sleep, stress levels, everything. Most diagnoses are pattern recognition, and you know your patterns better than any doctor ever will. Bring printed logs to appointments. It forces doctors to engage with data instead of making snap judgments. One study found that patients who bring detailed health records are 40% more likely to receive accurate diagnoses because doctors have to actually analyze instead of assume. I did this 2 years ago when doctors kept telling me my fatigue was just stress. 6 doctors, same answer. I started tracking everything, sleep, diet, energy levels, and noticed patterns they missed. I brought 12 pages of data to a specialist. Turned out I had a thyroid condition that's easily treatable but often missed. If I'd trusted those first 6 doctors, I'd still be exhausted, thinking it was my fault. The system failed, but data saved me. But here's the final twist. Even this video is making you distrust, and distrust without discernment is just as dangerous as blind trust. Not every doctor is corrupt. Not every diagnosis is wrong. Many doctors are genuinely trying to help within a broken system. So the point isn't to reject medicine entirely. The point is to understand that doctors are human, fallible, working in a system with perverse incentives, and your health is too important to outsource completely. You can't change the healthcare system overnight, but you can change how you interact with it. You can ask questions, demand explanations, seek second opinions, do your own research. The doctors who are good will respect that. The ones who get defensive when you question them. That's a red flag. A good doctor welcomes an informed patient. A bad one wants obedience. So here's your choice. You can keep trusting blindly, hoping you're in the 60% who get the correct diagnosis and treatment. Or you can take responsibility for your own health. Treat doctors as consultants rather than gods, and recognize that you are the only person truly invested in keeping you alive. Right now, if you're on any long-term medication, look it up. Find one peer-reviewed study about long-term effects published in the last 3 years. Just one. You might be horrified by what you find. Share this with someone who blindly trusts their doctor, especially someone dealing with chronic illness. And if you want more content that challenges systems instead of worshiping them, subscribe, but only if you're ready to take responsibility for your own health. 10 minutes ago, you trusted doctors without question. Now you know better. Your health, your responsibility, the white coat doesn't make them right.